Welcome back. I'm Madeline Stewart. Annual enrollment for Medicare is upon us, and it's so important to figure out which plan is right for you. Joining us is Brian Spencer, a licensed Medicare specialist. Thanks so much for being here.
Thank you, Madeline.
What are some common mistakes that you see people making when they're choosing their health care plan?
Well, I respect everyone's intelligence and their ability to go online and do a little research on their own, but there's always a little quirk here and there, and you want professionals to do the research for you and then just make a suggestion. The biggest mistake I would say is just not contacting a professional and letting them find the plan based on your specific needs and your specific prescriptions.
Now, as we're in this period of annual enrollment, what are some options that are still available for those who have already signed up or those who still have yet to sign up?
Well, everyone has until December the 7th to make their final decision. So perhaps you have enrolled already, but maybe you did it on your own. Maybe you're not 100% comfortable with the choice that you made. You can still contact Palmetto Medicare before the December 7th, and the last decision you make before that day will be the one that you'll go forward with in 2025.
Now, for those who haven't turned 65 yet, that happens outside of annual enrollment. What advice would you give them as they kind of look towards that time?
Just save the number on your screen or write down my website, palmetto-medicare.com. They can contact me, and it may not just be you, it may be a relative or a close friend. They'll be turning 65 soon. They'll need the best advice they can get when they turn 65 for the first time. So contact Palmetto Medicare would be the best advice I could give them.
There are a lot of different situations out there. Some people are still working at age 65 realistically. So do you recommend that they stick with their employer's plan or they hop on board with Medicare?
Well, that's not an exact science. All employer plans are different, just like all Medicare health plans are different. So the only thing I can suggest is make a comparison between which one suits you best. There's also other factors about maybe your spouse is covered under your plan, and it's not a good time to move and switch or do anything that could put you in jeopardy with your health coverage. So just contact us. We'll do a comparison and offer our best advice.
I can tell that these are valuable services that you provide to people, really one-on-one here, working with each specific plan. So what do you charge for this service?
Oh, there's no fee for our service. To contact Palmetto Medicare, for us to do some homework for you, to ask us some questions, no fee whatsoever. And as a matter of fact, as a reminder, we donate $25 for every client who signs up with Palmetto Medicare to St. Jude Children's Research Hospital. I'm very proud of that. That
is an amazing little thing that you do there just to give back. If people want to learn more about your services or maybe reach out and get in touch with you, what's the best way to do that?
Well, the easiest thing to do is to hop on the website, palmetto-medicare.com, or they can just give me a call at the number on your screen.
Wonderful. Thanks so much for being here, Brian.
My pleasure. Thank you for having me.